So yeah, before we start looking backwards, we're going to spend a little bit of time looking forward. So I'm Ross, and today I'm going to be talking you through two recently produced document sets by Integrated Care Systems for Integrated Care Strategy and the Joint Forward Plan. Before I get started though, I'll just give us a bit of a refresh on integrated care systems. So integrated care systems are partnerships that bring together NHS organisations, local authorities and others to take collective responsibility for planning services, improving health and reducing inequalities. There are 42 integrated care systems across England with a population of about 500,000 to 3 million. In some form or another, integrated care systems have existed since 2016. At this time, they was using their soft power and influence to try and enact change. But since the 2022 Care Act, they've had statutory responsibilities and have two bodies which they operate through. The first is Integrated Care Boards, which are statutory bodies that are responsible for planning and funding most NHS services in the area, and also Integrated Care Partnerships, which are statutory committees bringing together a range of system partners, including local government, DCSE organisations, NHS organisations, and they develop a health and care strategy for the area. Integrated care systems have four stated aims. The first is improving outcomes in population health and healthcare, tackling inequalities in outcomes, experience and access, enhancing productivity and value for money, and helping the NHS to support broader social and economic development. These are really important, and I'll be coming back to these throughout the discussion today as they kind of guide and set a theme for the priorities and challenges that integrated care systems are trying to address. So just in terms of what we've done, we've looked at both of these document sets for all integrated care systems. We managed to find 40 integrated care strategies and 37 joint forward plans. When we were reviewing these documents, we had kind of 5 key questions in mind. These were, what were the priorities? What challenges are they trying to address? What are the enablers in the system that they could leverage? What do they actually say about adult social care? And how do things change over time? Do they provide a specific timeline that breaks things down? We compared all of these plans using an Excel spreadsheet, looking across the differences and similarities, and also thinking about some of the differences between the 7 regions that exist, and also if there's any differences between urban and rural areas. And after doing this, we then reflected on the key findings, which I'll be talking through today. One thing just to note as a methodological challenge was that these plans really do vary. Some you could only access an 8-page summary document. For others, there was kind of like 150 pages. So we're not necessarily always comparing like to like, but across these themes, you could see some similarities that I'll be talking about. So starting off with integrated care strategies, what are they? As part of the Health and Care Act, it requires integrated care partnerships to write an integrated care strategy to set out how assessed needs can be met through the functions of the Integrated Care Board and their partner local authorities. The strategy should set the direction for the system and also set up how organisations and partners can work in a more joined up, preventative and person-centred way. And the strategy provides an opportunity for integrated care partnerships to set out their ambition, focusing on the next 5 years up until 2028, and outline the differences that can be made by working in an integrated way. And the second document we looked at, joint forward plans. Again, this is stipulated as part of the Health and Care Act that integrated care boards and their partner NHS trusts and foundation trusts should create and publish a joint forward plan. The joint forward plan should act as a bridge between the ambitions described in the integrated care strategy and the detailed requirements contained in the planning submissions. There's actually a lot of flexibility given to integrated care boards in terms of what they do with their joint forward plan. They can choose how they develop it, how they structure it, but they are encouraged to use it as a delivery plan for the integrated care strategy. This again contributes to that kind of difficulty in comparing them like to like as they're completely differently structured sometimes. At a minimum though, the joint forward plans should describe how the integrated care board and its NHS partners intend to meet the physical and health needs of their population for arranging and providing services. So other recent plans. Over the last few years, there has been a lot of work towards integrating care. You can see this through non-statutory integrated care systems since 2016, health and wellbeing boards, and also through Better Care Fund plans. So there's a lot of work that's been going on in this space, kind of trying to push towards transformative care. There's also joint health and wellbeing strategies which support the local system to work together in partnership to improve the health and wellbeing of the local community and reduce health inequalities. And in addition to these, you also have lots of local council plans, local NHS plans, which go into kind of more minutiae detail. We've not looked at all of those for that, but it's likely they'll focus on kind of more of a place-based and borough level changes that will be happening of those priorities as well. Focusing first on first one of our questions, which was what were the priorities outlined in both of these documents. So every single one of the plans that we looked at included a sense of some of their areas of focus. They only branded them under slightly different terms, whether that was their aims, ambitions, or kind of vision. And they also had quite commonly a vision statement, which was about 2 sentences, which just provided an overarching sense of where they're going into the future. There were a lot of similarities between these different priorities, though, which I'll talk through today. So one of the first ones that came up quite frequently was improving coordination of care and integration. So this was really about joining up primary care, social care, community care, and removing away from siloed working. Improving population health outcomes. There were quite a lot of different components that were related to this, including reducing health inequalities and prevention and early intervention. And it's within this section where you probably see some of those historical priorities that we had across systems, like reducing smoking, reducing obesity, and focusing on mental health. And within this component, we also had a focus on addressing the wider determinants of health, so things like social inclusion, education, and employability. Increasing workforce capacity and workforce development. Probably unsurprisingly, a lot of these plans were talking about the shortages that exist at the moment, trying to improve processes in recruitment and retention, and also trying to improve staff wellbeing and reduce burnout. There were a number of mentions of access and waiting times, trying to improve access to things like emergency care, urgent care, and elective treatments. Currently, people felt are waiting too long. Providing more care close to the home and in community settings. This was really about moving people out of emergency care, out of hospital beds, into the community supports or other support avenues, and also about strengthening primary and community support. Making better use of digital data and technology. This focused on kind of increasing data sharing, improving understandings of clients, and also using data analytics to improve understandings of kind of population level health. Financial sustainability and efficiency. There's an acceptance that there's kind of been increasing cost pressures experienced by the NHS and reduced budgets. This was really about trying to increase productivity and value for money. And then the bottom two were all about engaging people who use services and communities into their decisions and design of services, and also making sure they have more of a say in their care. Just to quickly reflect on the 4 aims that I spoke about earlier for integrated care systems, I think for most of these we can see almost direct parallels. Number 3, enhancing productivity and value for money, very closely links to financial sustainability and efficiency. And the first 2 link very closely to improving population health outcomes, and then helping the NHS to support broader social and economic development, linked to some of those wider determinants of health I was speaking about. So you can see how all of their priorities do quite closely align with what they are supposed to do as integrated care systems. So we also looked at system challenges. As you can see, not all of the integrated care strategies or joint forward plans identified challenges, but the majority of them did, 27 strategies and 31 of the joint forward plans. I'll quickly run through some of these because they're almost the inverse of the priorities we were speaking about earlier. So fragmented and uncoordinated care, many organisations working in silos, they're not being pooled budgets, and there being kind of gaps between services. Workforce shortages and recruitment retention issues. This was one of the biggest challenges experienced across both the health and social care sector, something that I'm sure many organisations have experienced as well. It's really difficult to recruit and retain people in this space. Health inequalities within regions. Within this, the area that was mentioned the most was gaps between the least deprived and the most deprived groups, and also gaps in services in certain geographical areas, so rural areas not having people being able to access services when they need them. Difficulties addressing wider determinants and behaviours driving demand. This focused a little bit on the public health approaches and some of the difficulties that systems have previously had trying to embed early intervention approaches and prevention approaches. Instead, it's kind of been almost crisis management more recently. Concerns about rising demand, cost pressures, and long-term financial sustainability. This linked to demographic changes, ageing populations, and also the very recent challenges that have been experienced across the board in terms of the cost of living crisis, really high levels of inflation, and funding pressures that are being experienced by services. Limited access, long waiting times, and patient backlogs. I think we've all probably experienced this. A lot of backlogs have been experienced due to the COVID-19 pandemic. People are waiting for really long times, maybe more than 2 years for certain support, and we've still not returned to pre-pandemic levels. Poor digital and technology infrastructure. Many services are still using legacy systems which are really outdated and don't enable shared information sharing. Cultural barriers and differences across organisations, which are stopping partnership working. And then finally, limited engagement of service users and communities. Although seen as a priority at the moment, this isn't something that's happening very frequently. There's not enough people involved in decisions about their own care, or there's not necessarily communities involved in design of services. The enablers, these were mentioned a lot less frequently. So just 17 of children's care strategies mentioned it, and 6 of the joint forward plans. What was more interesting, I think, about this is these aren't necessarily current enablers within the system, but things that they anticipate they could leverage if they did manage to crack them. First, is leadership, culture change and joint governance. There were some examples of joint boards and committees which have been able to bring people together and galvanise change. We're hoping that these can kind of set the culture and allow the workforce to focus on integration. Joint commissioning and funding. There are some examples of pool funding commissioners working together. This is something that we hope to continue to achieve over time and have things like joint assessments. Workforce development opportunities, things like joint training do exist within the system. There are some examples of new roles being created and some systems doing some stuff to try to improve experience of the workforce. I think that's definitely an area of focus for a lot of places still. Digital technology and information sharing. This was one in particular where I think we feel if we can crack this, it will make a massive difference in terms of integrated care, especially when it comes to having access to similar systems, shared case management systems such as that. Co-production with service users, again, not happening too much at the moment, but something that was felt like if we could start to do this more, it may really improve outcomes for people and communities. Easy access to community services. There were a number of examples of single points of access, multidisciplinary teams, and also community hubs, which are acting as really great ways to integrate care and provide people the support they need when they need it. And then finally, appropriate housing and facilities. In a couple of plans, it mentioned kind of residential housing options where people can live self-sufficiently, but also have access to integrated care when they need it, and the success that can sometimes have for the wider system. Regional differences. So we looked across the 7 regions to see if there were any major differences between the plans. And I think the key message here is there wasn't really very much difference. But what we would like to do is just talk briefly about some of the differences that we've seen. And so, for example, in the east of England, there was a bit more of a focus on the challenges experienced by the pandemic and also on ageing populations. In London, he was really focusing on tackling waiting times, health inequalities and the wider determinants of health. But interestingly, there was also a focus on green policies, so things like trying to achieve net zero, which we didn't see too frequently in other plans. In the Midlands, there was an interesting concept which was mentioned throughout, I think, nearly all of the plans, which was starting well, ageing well and living well, which encompassed lots of different elements of how people experience care. And interestingly, they also talked about financial pressures and sustainability a little bit more than the other plans, which is probably unsurprising given the current circumstance within Birmingham. North East and Yorkshire, service quality was mentioned quite frequently, as well as deprivation and poverty, real areas where they're trying to address. In the Northwest, there was a bit more of a focus on prevention and early intervention, as well as, similar to the East of England, a focus on kind of a growing ageing population and some of the complex needs that come with that. In the Southeast, there was a focus on productivity and sustainability. And then finally, in the Southwest, there's a bit more of a focus on sustainable models and social wellbeing, which is a little bit less common to see in some of the other areas. So we also looked at the plans in terms of urban locations and rural locations. No surprises again, there weren't a massive amount of differences. There was probably a bit more variation in the challenges they're experiencing than the areas that they're focusing on in the future. In terms of where they are focusing, areas like London, Birmingham, Manchester, really focusing on health inequalities, community engagement and addressing the wider determinants of health. Whereas in the more rural areas like Cornwall or Cumbria, they're focusing on prevention, self-care and improving access to services. I don't think the challenges are particularly unexpected. In terms of urban areas, they have very diverse populations, often high concentrations of complex needs and deprivation, which they're struggling to address. And in rural areas, some of the challenges come from actually just having dispersed populations, which means it's difficult recruiting people into the workforce when we need them. People can have challenges accessing services, and also people can suffer through things like social isolation, which is sometimes a bit less common in the more urban areas. But that's not to say that some plans aren't quite specific. Some of them do go into a lot of detail in terms of their priorities on a local level and actually have some actions which are very different to other areas. And it's particularly the actions and the activities where we start to see some of this variation. In those documents where you've kind of got 150 pages of different things that they're focusing on, it's quite different to some of the other areas. And you also saw in some areas, some integrated care systems which cover large geographical areas and multiple local authorities, like Greater Manchester, that they had different priorities based on the place-based needs of those local authorities. There was some variation even at the plan level, depending on the size of the population that it covered. So I guess the most important thing for this room, what do these plans have to say about adult social care? I think the big takeaway is not very much. So only 14 of the strategies, and 15 of the joint forward plans mentioned social care at all. That was doing a control F in a lot of these documents to see if we could see even the word reference, which maybe says something about where they're focusing. When it was mentioned, it was most commonly in relation to ageing well, better care, providing more care in the home and the community, moving out of hospitals, and information and shared care records. I've just put up a couple of examples on the screen of 2 integrated care systems that did mention adult social care, just to show the variety of detail which is included in these plans. So in Cambridge and Peterborough, they had an entire chapter which was on integrated health and social care. This outlined the need for long-term support, effective transfers between health and social care, and also included some detail on quite specific challenges. They talked about people who are eligible for arranging their own care but not accessing the funding within the local community. Whereas another example, North West London, they do mention adult social care, but it's only a couple of sentences. We just talk about the challenges that are experienced by a growing population, ageing population, but lower budgets per head. Unsurprisingly, a lot of the challenges that I mentioned on the previous slides, when adult social care was mentioned, also relate to adult social care. So it's workforce challenges, recruiting and retaining staff, issues around digital technology and its use, and also challenges integrating social care with health. And then the final question we explored when going through these documents was how progress will be measured over time. So both the integrated care strategies and the joint forward plans look over the next 5 years, up to 2028. And there wasn't very much detail at all on these plans. I think it was most common for them to just have overarching aims, overarching strategies, overarching ambitions, and outline some of the challenges without going into detail of when they'll address them. These documents are very much setting out the ambition, even though the joint forward plan in particular is meant to be a delivery plan for the integrated care strategy. So you'd expect to see more detail, but in reality, they were both very similar in the way that they talked about these things. And as it says on there, it was just sort of stated aims and activities. In a few strategies, it was acknowledged that they're interim documents. I'm not entirely sure what that means, but I think it's obviously a fluid process, but it's going to be a long while until another one of these is created. As Derby and Derbyshire Integrated Care Board says, this is an example of it being an interim document. The strategy will not be static. The national guidance requires that integrated care partnerships must consider revising the integrated care strategy whenever they receive a joint strategic needs assessment. Therefore, further versions of the strategy will be produced and published in line with this requirement. So it's almost a kind of watch this space message. Priorities may change, we'll have to see. Some plans do go into a little bit more detail, providing an estimated timeline, and I've got an example of one of those on this slide. So this is taken from Staffordshire and Stoke-on-Trent's joint forward plan. I think this gives a perfect summary of the integrated care systems that do mention a timeline or a sense of when things will be completed by. So by April 2025, it looks like they'll have developed robust governance. There's no real extra detail in the plan beyond this, so I'm not entirely sure what developing robust governance means, or by April 26, ensuring services deliver value for money. Again, what does that mean? I think in business speak, we often talk about SMART targets, which I can't remember exactly what the acronym stands for right now, but but these, specific, measurable, achievable. Thank you very much. Yeah, and I think what we can see is that these targets, unfortunately, aren't any of those things. They have maybe a timeline, but what does that mean? What does it mean to develop robust governance? And within most plans, it was really common to see lots of priorities and actions. In this, they were their kind of top 5, but there was lots of other things that they're hoping to achieve. Most of these weren't time-stamped. Most of these didn't have specific targets attached in terms of what they're trying to reduce, what they're trying to improve. Instead, they sort of pointed towards other documents within the system. So you mentioned health inequality strategies, violence reduction strategies. We've not looked at all of these strategies, but it's sort of indicated that maybe they provide a little bit more detail, maybe the NHS planning submissions provide a little bit more detail, but within these currently we don't have that information. And I've just provided at the bottom a couple of example targets that were included in the Staffordshire and Stoke-on-Trent forward plan. So the first one is about reducing presentations to A&E and ambulance services. No time when they hope to achieve that by, and also just reduce. Doesn't really mean, I guess if that's by 1, that may be a success, but it's difficult to know from that target. The second one was actually one of the more positive targets we saw in the entirety of these documents, which was time-stamping each of the reductions they hope to achieve by a year for waiting lists for treatment. So over the period, they'd like to reduce from 65 weeks to 18 weeks. And that is quite measurable. We'll be able to see if they achieve that, but I think that was one of the only areas where we saw something like that. Then just to provide a couple of concluding thoughts. Across the integrated care strategies and joint forwards plans, there's a lot of general alignment. You'd expect this since the joint forward is meant to be a delivery plan for the integrated care strategy. The one thing that we don't really see is the joint forward plan advancing or moving you forwards from the integrated care strategy. They're almost just differently written documents that cover the exact same topics. One thing that's probably positive to see though is that the 4 priorities I mentioned that integrated care systems should be focusing on and their stated aims do appear throughout the overarching ambitions of these documents, both the joint forwards and the integrated care strategy. But I think it's really important to note that these documents are extremely health-centric, with limited mention of social care. Instead, they're focusing on the struggles that integrated care systems are experiencing, like fragmented services, access and workforce shortages. A bit of a complication when fragmented services include social care. It seems like there's a bit of rhetoric which is focusing on improving coordination, joining up services, but actions without an inclusion of social care, it becomes very difficult to see how that's actually going to be achievable. And then finally, just again to reiterate that point, there's very limited detail. These documents really do set out an overarching vision, but if you want to go into them and see when things are meant to be achieved or know how to measure success based on these documents, they're not a particularly useful starting point.